you can tell us what you guys have been up to. Dr. Sunil, you could begin what you've been up to over the last few years and what your passions are.
So for the last, well, I've been on this conference for the last 4 years, which I appreciate, always coming back. But, we run the largest plant-based practice here in the Southwest in Albuquerque, House of Sanjevani Integrative Medicine Health and Lifestyle Center. I have a private practice. We've been working with integrative medicine, which is evidence-based, as most people know. And most people know that most of my patients are going to be traditional chronic disease patients. And then about 60% of our patients are cancer patients. And we've had great successes with improving outcomes of all sorts of reversing diseases and chronic conditions with looking at inflammation, immune system, and a variety of natural aspects of dietary and lifestyle practices to help our patients move forward.
Great. Thank you. And Julieanna, how about you?
I have been here too, and it's nice to be back and nice to see everyone. And I've been, really focusing on my private practice. I work with clients around the globe. I focus on doing lifestyle transformation, mostly lots of weight loss, chronic disease management and reversal, and, writing, social media, all the fun stuff, speaking around the world, all the good stuff, talking about plants.
All right, great. So let's go ahead and get it started. So I'm going to throw the first question over to you, Julieanna. So your book promises weight loss for the last time. In your book, the Choose You Now diet. How is it different from other diets that tend to have yo-yo kind of results where people lose weight and then they end up putting it back on?
So I'm not a typical dietitian. I don't count, calculate, measure, or weigh. My role is, of course, we have nutrition and the actual diet parameters themselves, but I really like to focus on the humanity of the situation and how we are living in this crazy world where no matter what you want and what your intentions are, you're surrounded by constant temptation, constantly being bombarded by temptation, and the normalization. I call it the modern day trifecta of overconsumption. And we've got, our biology is built to want to eat as much calorie as possible to survive in times of scarcity. But the second part of that trifecta is that we are constantly being bombarded by these tempting messages and everyone else is eating it. And then the normalization of overeating and overeating junk food. And of course, it's really hard to lose weight. It's really a really toxic food environment. So I help my clients. We have all the science and the nutrition parts, but I use plant-based nutrition. I use time-restricted eating, but I most importantly focus on the behavioral strategies for changing your relationship with food. And so the whole idea is, how do you navigate these crazy social situations? How do you navigate life? Because there's always going to be something that pops up that makes it a little bit more challenging. And so once you learn, I always tell my clients I want them to have a PhD in weight loss, but most importantly, they're also aggregating a PhD in weight loss maintenance in the process of understanding why they make the decisions that they make towards food. So it's mostly psychology, sociology, and behavioral, and dealing with everyone around you so that you can do what you want to do and stand in your truth and be able to accomplish the goals that you want to accomplish.
Okay. And Dr. Sunil, what do you suggest for people to live a lifestyle where they're not fluctuating in weight, which is so common? People take these short-term strategies to lose weight and they end up putting more weight on than they started off with.
Yeah. So when when we look at our patients, so taking where Julieanna's going with her clients correctly, we kind of go a little bit more into the physiological and anatomical, immunological side of looking at, as a physician, looking at then dysfunctions, imbalances, right? So we can then test the nutrition. We can actually look at the microbiome. So in addition to seeing like the environmental lifestyle stressors that which she mentions it's absolutely true. It's bombarding and confusing for the client, even when they want to lose weight. It's because everything is promoting them not to lose weight, or they're now selling you a drug just to say, just take this and not do anything, right? But for what we like to look at is we look at the pain points of our patients. So we look at, what are the triggers of inflammation coming into the diet. Even from a plant-based food, you can still have inflammatory triggers. So once we start looking at reversing these diseases, then the weight loss just starts to come off, because that's kind of the added benefit of getting healthier. And so I look at it like, how do we fill in the gaps? Because a lot of people want a quick fix, and she's absolutely right. There's a lot of psychology, a lot of sociology, a lot of environmental strategies that we have to develop, which we also explain and educate our patients. But then we can kind of look at certain other points where they might have all that support, but they're still having some pitfalls or some setbacks, and we're able to find those subtle setbacks or those little road bumps, and able to have a smoother ride or smoother forefront of getting them to where we need to get them.
Great, thank you. So, Juliana, the keto diet is extremely popular. I don't know why, but it is. And based on the best evidence, what are your concerns about its long-term health consequences?
It's a popular diet because people want to eat certain things, and that kind of gives them permission to eat as much, cheese and meat and all those like ooey gooey stuff that they've kind of been craving. But then, you can't avoid the truth, right? Like the fact is that you could lose weight on any diet. They've been shown you could do it with Twinkies, you could do it with any kind of food. And losing weight is not necessarily like so exciting. It's the fact that you could do it healthfully on a plant-based diet. And we know the science on eating high consumption of animal products shows increased risk factors for pretty much every disease across the spectrum. And so I have people that are recovering from a keto diet come to me, and I look at their labs, and it's exactly as we would predict from the literature. They're, elevated triglycerides and lipids, and like everything is so pathogenic that it's just exactly what we would expect. So you could do it, you could lose weight, but you still aren't going to be healthy. And the best thing about a whole food plant-based diet is you could be healthy and lose weight at the same time, and you can just extend your health span and longevity, and so you get the best of both worlds.
So now I'm going to ask you about somebody who's controversial, but I'm not talking about anything other than his diet and the diet of his wife and his daughter. So,
I know who you're going to say.
Yeah, Peterson. Yes. So Jordan Peterson, has, I guess his daughter was had some chronic illness and was actually quite sick. She ended up going on an all meat diet. I think there's a little bit of salt. I forget, it's like one other thing that they put into their diet. And then I don't know what Jordan Peterson's issues were or his wife's issues, but they decided to follow suit and claim to have resounding effect. They're not selling anything. They're not selling any books on the diet. They don't have any sort of ulterior motive that I can tell. And assuming they are, really doing this diet, and they said they don't even like doing it, right? Because it's really hard. It's very boring. But they look vibrantly healthy. They're cognitively very sharp, and they claim that their medical issues that push them to go into this direction are gone. Yeah, are resolved. So what are your thoughts on that? Is that likely? Is it possible? Obviously, probably not good for everybody, but why would this be?
Okay, I'm obsessed and fascinated by nutrition and health and all this. So
Yes.
I was like, wow. And I listened to him speak. And so I'm always like, what could this possibly be? Like you have to, because again, you have to look at anecdote and story very objectively with a lot of skepticism.
Mm-hmm.
So first of all, there was a cancer scare since said died in the mom. So we don't know, and you never know. Cancer is a much more complicated mechanism, etiology and all that. But my hypothesis, without knowing them or seeing their lab work, because we don't really know what's going on. I haven't looked at their labs or known any details of their actual prognoses and their journeys. My hypothesis is if you're eating a standard Western diet full of sugars and all these other, fried foods and all these other things, lots of flours and all these other things that are pro-inflammatory, because the daughter had a autoimmune disease. That's what it started with, I think.
Yes.
And so with if you start from there and you eliminate a lot of that stuff, that's my hypothesis. And maybe they eliminate all these other things that were pro-inflammatory, and so they're able to sustain this right now. But we haven't looked at long-term labs. If it were my clients, I would want to see their before and after labs. I'd want to track them. I'd want to see. But if you're simplifying your diet that much, that's a step in the right direction. And again, you could lose weight, and losing weight helps improve outcomes of different health circumstances. So like, even if you're just losing that weight and you're eliminating all these other foods, that could be an amelioration from where they started. So it's compared to what is a question not asked often enough. And I can say that generally speaking, but again, I haven't looked at them specifically. And I think it'll be interesting to see how it unfolds. I wish them the best. So it's interesting.
And Dr. Pai, your thoughts on a diet like that and the results that they claim to be seeing?
Well, it's just a claim, number one. It's not science. It's just an N of 3.
Agreed.
Right? So if someone's eating a pro-inflammatory diet, high in omega-6, high in oxidized cholesterol, little to no antioxidants, absolutely no phytonutrients, no fiber, increasing dysbiosis, increasing endotoxins, LPS, eating high HCAs, TMAOs, insulin growth factors, new 5GC, they are increasing their heme iron, they're increasing their insulin resistance, decreasing their metabolic resting rate, increasing their pesticides and bioaccumulation of toxins and even nanoplastics and stuff like that, which we now have data on. There's really no study that will show you know that eating an animal protein or eating animal proteins prevent or reverse or treat diseases.
Okay. Thank you.
Well, let's go on further.
Oh, go ahead.
Let's just say that there is no study.
Right.
Right. So is there, can this be a one-off? Sure. Would I recommend it? Heck no. But people are, this is America. They can do whatever they want, and people can promote whatever they want. But the idea is that, I'd put money on and say, well, where are these people in 5 years? Because I see patients every day, right? And I see patients who are on the carnivore diet. I see patients, and they come in, and I have patients between 30 and 35, had 4 of them in the last 2 years coming in with stage 3 and stage 4 colon cancer. Right. So like that's the reality. Like we see more disease than people saying, oh, I'm free of disease. Right. But the media and everybody wants to spin this story of like, oh, I eat something. It's like that's not how science runs. That's not how really the data. If you look at large populations or even randomized controlled clinical trials. But again, that doesn't mean anything to most people who just want to believe what they want to believe. So like, buyer beware, just letting you know, like, people want to get health advice from, these random stories. And that's what gets, in the news, it gets us talking about, oh my God, I don't even want to give any attention to misinformation or bad information.
Sure. So, so Dr. Pai, can you elaborate on the 10-step guide mentioned in your book for reducing inflammation?
Yeah, so these are just some of the 10 steps, but it's really looking at an epigenetic approach, right? So we know that epigenetics is what we need to do in terms of turning our genes on and turning the genes that we don't want to turn on, turn off. Okay, so we want to always start off first eating a plant-based diet, whole foods if you can, plant-based diet, and also trying to look at shifting those to being more organic and kind of cleaning up the environment. We also want to then go to looking at testing and looking for triggers of inflammation. That is my specialty, and I wrote a book, An Inflammation Nation, as most of you know. And so we're looking at it, even if you do shift to a plant-based diet. So, some of these clients or some of these people who write these stories, they might have a lot of sensitivities. And so by them restricting their diet, they feel good. So understandably, there's a health benefit of removing certain foods, but you can't be removing all the foods. And even from a plant-based perspective, most of my patients who come in who are maybe not a plant-based person, they're eating a standard American diet or paleo keto diet, they will have inflammatory triggers, but not just only on an animal protein. They can have inflammatory triggers, either immune from an immediate perspective within an hour, up to 4 days later as a delayed for plant-based foods as well. So we really want to look at an individual and saying like, what is coming in that's triggering inflammation? We want to look at then detoxification, and not talking about just a cleanse or things that people see on the health, on the Instagram and these little programs. We're looking at detoxification markers. We're looking at the microbiome, looking at, the amount of fiber and short chain fatty acids. And we're looking at how the body, biochemically and systematically and functionally actually work at, clearing toxins, not just, take a product. And you'll see a lot of people just, hawking product and selling programs. We want people to stop smoking, and now there's a big increase of vaping, which I wrote about, which there's a lot of dangers, and now that's come full front in the information. We also want to look at decreasing the use of non-steroidal anti-inflammatories, because a lot of people, 30% of the population is taking an ibuprofen, Motrin, Advil, Aleve, Celebrex every day. And if you don't know the dangers of those, I definitely recommend reading my book so you can understand what a black box warning is. Then we move to like giving anti-inflammatories, natural anti-inflammatories in our patients, in addition to the anti-inflammatory diet that we then kind of find the triggers and targets of. And that is looking at using the natural anti-inflammatory that is the flagship called Bosmeric SR, which we have now hundreds of thousands of patients now in the last 16 years now using worldwide, and that's the strongest natural anti-inflammatory. I can talk about it a little bit later. We look at then strengthening the immune system by natural agents, even just checking vitamin D levels, to actually giving things like Glucan 300 that are patented and clinically tested, but looking at natural killer cell functioning, lowering inflammation. We also then want to make sure our patients have good healthy blood glucose levels, their reduction of their salts and sugar intakes. We want to look at stress reduction, right? And also doing balancing and strengthening and like practices like yoga. And then we finally all look at rounding out social interaction and sense of purposes. These are all the things like when you look at blue zones, right? Simply that's kind of come back into the vogue now, is looking at, what are the healthiest people living the longest do. And that's kind of what you really want to be kind of following, that, because that's the proof in the pudding, not just 3 people who've restricted their diet, for example.
Right. So, Julieanna, in the context of Candida overgrowth and its association with cognitive symptoms such as brain fog, can you share holistic strategies for effective management and eradication of this condition?
Not my department.
No. How
No.
about you, Doc? How about you?
Yeah. So first and foremost, you have to test. So the challenge that you'll see in the natural world or the alternative world, particularly on social media and everything else like this, is that everybody will claim a symptom and they'll say, well, that's Candida. And that was like the big thing in the 80s. Now it's still, again, it's coming back in vogue. We now understand that you can have dysbiosis of a variety of different kind of mycology, different kind of funguses, different kind of series or species of bacteria, which is another section, right? So a lot of times people say, oh, it sounds like Candida, because it does people that have overgrowth of mycology species, right? Fungal and Candida and otherwise, and yeast of otherwise that are in the gut. It can cause these, brain inflammation. It can cause all sorts of symptoms, GI symptoms, inflammatory conditions, etc. However, that's just one set, right? So there's also bacteria that can do that. So when people take a cleanse and they take an anti-candidal product, if they don't know that they actually have candida, because most of them now don't actually when we test them, they actually have a bacterial overgrowth, for example, right? And the symptoms are the same, but the treatment is different because you have to give an antimicrobial. If it's a fungus, you have an antifungal. Naturally, in my perspective, I don't need to get. Some people can take prescriptions, but I prefer natural. And if it's a bacterial overgrowth, there's certain natural agents that are this. But when people just randomly take these things, which they do all the time, they're actually causing more dysfunction in the microbiome. And we understand that it's because we test that in our clients. And we can see people who do cleanses and do colonics and take all these programs, and they actually come in and their microbiome is completely dysfunctional. And so we have to rebuild that. So I'm really cautious now. There is products that can be given, but now here's the interesting thing that we have, that when we do testing, we go further because we look at the sensitivities and the resistance to natural therapies or prescriptions. So a lot of people go, oh, I've been taking this, oregano oil or berberine or uva ursi, or I'm taking this product that my chiropractor, my naturopath, or I put my hand on this machine and it told me something in the back of a health store. We go further than that. We want to look at, like, in your gut that they grow in microbiology, what actually does work and what doesn't work, and be surprised that how many natural things are now becoming resistant because people take things all the time. People take things for cleanses just too much. Like, they may not even have the symptom, but they think that's what it is. And then it's like taking amoxicillin, thinking you have an infection when you don't. And then most people say, I wouldn't take amoxicillin, I wouldn't take an antibiotic, for months, but they take a candida cleanse for weeks, right? So what we like to look at is be really evidence-based and targeted, so that we know, like, if that patient has a problem, then what is that? And then individualize that treatment rather than doing the shotgun approach. Even with natural therapies, that's what's happening way too much, in my opinion, is that more people are now coming in, doing these things, thinking it is. And then when the data shows that it's not, then it's like they've caused more harm than good. Now, for those people who actually have the problem, then we want to get it more targeted with less side effects and then get rid of that problem and then restore it. When people sell a program, in my opinion, and they say, oh, you got to do a candida cleanse or a cleanse every 3 months, that means they don't understand physiology, anatomy, immunology, and how to restore someone's health. Because once you solve the problem, you're pretty much done with it. You don't have to keep doing it. That just means people are selling you dysfunctional information to sell you a program.
Thank you. So, Julieanna, you've authored many articles on plant-based nutrition for healthcare professionals. What are the most critical messages you wish to convey to the medical community?
Oh, so many things. I guess my call to action is to remember that food is so important and to incorporate dietary strategies, or at least offer the suggestion to their patients that it doesn't have to be pharmaceutical only, and that there is, like, extraordinary evidence of reversal of these major chronic conditions with dietary practice and lifestyle medicine. And so just having that information and knowing how powerful diet is, that's my number one call to action to the healthcare professionals that I was writing to and speaking to.
Okay. And this is going to be for both of you. Julieanna, you can go first. So intermittent fasting is gaining popularity. How does that fit into the plant-based lifestyle, if at all, according to your research?
Well, I do incorporate time restricted eating with my especially weight loss protocol, but It's more for, well, there's all so many benefits, and it's not, you don't have to conflate plant-based diets with intermittent fasting, because basically one is like the timing of eating, and then one is the context and quantity of what you're, the quality of what you're eating, the food that you're eating. So you could do it in any kind of dietary pattern that you prefer. Obviously, I recommend the whole food plant-based diet as well in conjunction, because you're getting the best of both worlds. So we know that if you're eating in a time restricted period of time, you're getting all this time in the fasted state. It looks like it can emulate the benefits of longer term fasting, water fasting, without, you know, disrupting your life. So it's got extraordinary health span advantages. It doesn't necessarily, shockingly, it doesn't necessarily have weight loss advantages metabolically speaking, because it really ends up being like an energy type of thing. But what I've noticed, and why I incorporate it with my clients for weight loss, is because it's a behavioral advantage. If you're eating, I actually have my clients eat 2 or 3 meals a day. Every time you eat, it's a meal instead of even doing the window. And because of that, they're able to, you know, eat less, mitigate hunger, and then you get all the health advantages long-term of having time in the fasted state, because that's a time when your body is able to do all of the other metabolic housekeeping that it needs to do, which gets bombarded when you start eating. As soon as you swallow, you are kicking off this cascade of metabolism, digestion, absorption that's very, very labor intensive, and it shunts a lot of the energy and blood flow to the GI tract. So if you mitigate that, you take time off of that, and you give yourself time in the fasted state, your body's able to do all sorts of other important things. And then it's just, in terms of weight loss specifically, because that's what I do a lot of, it really does help with the behavioral patterns and hunger mechanisms associated with, you know, losing weight in an easy way, sustainable way.
Any thoughts on this? And also, you know, talk about weight loss, and a lot of your clients are weight loss clients. Ozempic has come on the scene, and that type of medication. Are you seeing, you know, what are your thoughts on that as far as it being effective in the short term, it being effective in the long term? What are the downsides to that? My understanding is it can cause long-term issues with you know, dumping of the stomach contents. So what are your thoughts on that? And then I'll get that from you too, Dr. Pai.
I appreciate this question a lot, because I'm always like, you always want to kind of err on the side of non-pharmaceutical therapy. And having worked with I've worked with thousands of people over 20 years now, and the behavioral component is really real, and a lot of people really struggle. So what I do with my clients before these medications is I teach you how to eat, when to eat, so that you're not hungry all the time, and to reduce the food noise. So that's what we could do strategically, but some people can't get there. And I think that these medications, as much as I'm not pro medication, have been so efficacious, and the safety looks really good. I think that it has it's been on the market for 20 years, and the safety seems pretty good. But here's where when I'm working with people that are on them or transitioning off of them, it's an opportunity. So if you really can't get rid of the food noise, and you really can't give yourself that barrier of change, that time where it takes to kind of change your habits, really solidify those habits, and this will help you and it helps them, you have this opportunity to maximize your habits right then. Because if you're not as hungry, right, because it decreases hunger, it decreases food noise. So you could take advantage of this opportunity and establish those habits that I would have you establish without the medicine or with the medicine. That will be sustainable. The problem, and this is what I'm seeing with the clients coming to me after going through this, is that they're not changing their diet, and the doctors don't know how to tell their clients what to eat or their patients to eat while they're on the medications. And so they're going to gain the weight back when they come off the medication. So that's a big problem. It's definitely, we know that that's a fact. But the other thing, what I work with my clients is, if you're eating less, because you have to eat less to lose weight, there's no way around it. You have to create a deficit in order to lose weight. There's no way around it. It could be keto, it could be Twinkies, it could be anything. You just have to eat fewer calories overall. So if you could reduce your calories, you're going to have less real estate on your plate. So what you eat matters even more. So instead of saying, oh, eat 500 grams of protein, believe me, you can't imagine how much protein the doctors are saying that's all that matters. But you're on these medications, you're eating less. So make sure you're getting your weight in pounds or more in protein. But what matters more is every bite counts more, because you're eating less. So you could use these medications really strategically and teach yourself these new habits that when you are eating, because you're eating less, you eat healthy, you eat, you know, more like you optimize when you eat, and you're learning your body and you're learning your signals without all the food noise. Then I'm helping people transition off these medications. But if you just go in it and you just like, oh, this is great, I'm just not hungry, so I'm eating less of my cheeseburger and I'm having less bacon and eggs, because you're trying to get all the protein or whatever the doctors are telling them, then you're not going to have long-term success. There's no way that you could, that's a diet mentality. That's what I try to break with my clients that's why I say lose weight for the last time. The diet mentality is you're on this path, you're losing weight for some reason, either you're, the bariatric surgery, you're shrinking your stomach, which you could grow back. You're on these medications, so you're shrinking your appetite, it'll come back. But if you learn how to eat and you learn how to eat healthy and you learn how to eat for maintenance of weight loss, you can get off the medications and establish lifelong habits. The problem is that the doctors aren't really pushing that yet. So that's kind of what I've been specializing in, is how do I help people optimize these medications if they're on them and they need them, because it could really, really help people get past that hump. And if they take advantage of it, it could be an amazing thing.
Great. Thank you. And Dr. Pai, your thoughts on Ozempic and those
So
types
let me start off with the first question that you asked that
Sure.
I forgot to ask,
the fasting?
which was the fasting. So what we see is this, is there benefits for intermittent fasting? Sure. Really what you want to look at is that why people feel so good about that in general. Now not talking about what Julieanna is doing with, once you get to the dietary and look, the sociology, psychology of getting better healthy eating habits. But we're looking at why people feel good overall. It's just because they're not putting pro-inflammatory foods in their diet, in their body. And so when they have that rest, they're just in the anti-inflammatory state. But actually, when you start looking at, once you find those triggers, right, even on a plant-based diet, then actually the need of fasting is eliminated. Because what we do is, when we test for patients' nutrition, then we actually can look at what foods do you need to eat more of? Because everybody wants to go healthy. So I got people who come in and they'll say if they are plant-based and they're juicing and they're doing all sorts of things, they're getting the full rainbow colored foods, which we should be getting, right? 50, 60 grams of protein, 35 grams of fiber. Great. But everybody's microbiome is different. Everybody's, assimilation, excretion, absorption is different. So when we start testing for those, and then we can then tell them what to eat more of and really start to individualize their responses, then the need for things like intermittent fasting is no longer needed. Now it's a great kind of hold down, I think, as a step to when people say, I need to control this behavior, that's great. But at the end of the day, when even if you talk to Dr. Clapper, one of the big guys for doing fasting for the longest and having clinics with tens of thousands of patients, now it's well, do we need to do that? Well, not necessarily. It's a big jump start. So for a lot of people, it's getting them to kind of, calm the body down, calm the inflammation down. But we like to look at is just find the triggers, get the nutrition optimized, individualized. Then it may not have to be as difficult. Now, if people can incorporate it, there's no harm in that. But I think right now it is a big trend. It's a very popular thing. And so, for those people who can utilize it correctly, I'm all for that. Is it sustainable for most people? Maybe not, because of their lifestyle or their job or their family and this and that. So I would use it kind of in specific instances. But the idea is that when I look at most people who are the healthiest people around the world, they're not doing intermittent fasting. It is a way to get there. So I use it, it can be used as a tool, but is it do I need to do this forever? It's no, if you ate the right diet and you maximize your nutrients and by evaluation and then again fine tuning, then things again 5 years from now it'll be a different discussion. This will be kind of past us, and everybody will be onto something quite different. When we talk about Ozempic, I'm not for Ozempic or any of the GLP inhibitors and all. And the reason being is the following. Number one is after you start seeing patients who've been on them, who've had the side effects, it's more that when you actually start looking at the science of it. Recently, there was a study that just came out, I don't know if you saw it 2 weeks ago, the Journal of Clinical Pharmacology, which they put a warning out, right? Now, the warning was that in male patients, because we do know that there's an increased risk of suicide, right? And that's been kind of dumbed down by the press because it's a big seller, right? This is everybody's cash cow. If you buy stock right now, you can retire really early because it's a big boom right now. Every company, they're even shutting down. There was actually about a dozen clinical trials in stage 3, stage 4, almost to the market, shutting down and just going for the weight loss drugs because it's that much of $100 billion or more value. And I think when I was doing a weight loss summit just about 2 years ago, and it was 10 billion market share. Now it's 100 billion market share, right? So everybody's pushing it. All the companies that's our number one thing. We're not going to cure cancer. We're not going to cure diabetes or childhood diseases. They're going to just push the weight loss, right? Because $1,200 per person or more, and now they're trying to get even Medicare to cover it for seniors, right? Which will bankrupt the Medicare system. But what we're not looking at is that in men, in the suicide risk, they actually had completion the highest. So that means men who have suicidal thoughts taking this drug don't just, because the antidepressants, a lot of medications that we give, unfortunately, not me, but the system gives, have high risk of suicidal thoughts. That's common, right? But the interesting thing is it made them lead to completion. That means men actually committed suicide on this drug, higher than normal and higher than when, like these people who didn't come in with that. Now, the drug company's like, well, we'll just push all of this risk on the healthcare provider to provide mental health. But everybody knows we have terrible mental health. We don't have any mental health in America right now. It's hard to get even to have a therapist, or VA patients killing themselves in parking lots right now because they can't even get mental health, right? So we have to look at one other thing is that when they did this, another study came out looking at the receptors, because everybody thinks they understand how this drug works. They don't, because in the models, now these are animal models, right? Because we don't have human models right now. There's human models that the studies they will lose weight. So yes, we do know weight loss will occur. Just like Julieanna says, like anything can make people lose weight. I mean, I can sell someone, duct tape and they can put it over their mouth to lose weight, right? So like there's ways that people can lose weight. They may not be healthy, but they can lose weight. But what they did is they were looking at the receptors in the animals. This is what they're basing the studies on. And this came out recently, about a month ago. But when they stimulate the receptor that they're trying to, these inhibitors, there's weight loss. And then when they block it, there's weight loss. So they're having the same response with turning it off and on, but it shouldn't be that way. So what that tells us that that's not really the mechanism of action of how it's truly working. Okay. Now, what we're seeing is the microbiome is becoming dysfunctional because, yes, it's a behavioral problem, but we know there's more neurotransmitters in your gut than your brain. That's why these people are having suicidal thoughts, right? But it's not just the suicidal thoughts, it's that you can't suppress the microbiome. You have to change the microbiome. Changing the microbiome, that's why when people do eat better and they start getting better nutrition, that changes the microbiome, that changes the neurological functioning of the patient, which helps them decrease with these behaviors. The problem is once we start eating these pro-inflammatory foods that are actually shifting, and we can actually now test. I mean, I was actually on a call last week with an immunologist in a lab and they were looking at certain things that people take, certain drugs. This is what because this is the large percent of the population is going to take this drug because everybody wants immediate weight loss. I understand that. I can't argue against that because who doesn't want to lose a couple of pounds, or a lot of people have a lot of more pounds to lose, right? Because that's been the whole push of the standard American diet. But we have to look at the long-term ramifications, right? This is just like this is the early, everybody's getting on. And then you're already starting to see there's already starting to have class action lawsuits because there's so many people taking it. Now, there's going to be a subsection for patients who take this, that it's going to be a game changer, right? Somebody's like very overweight, very diabetic, et cetera, et cetera. Yes, they can lose the weight, they can lose it, but that's just a temporary fix. They haven't changed their behavior, like she said, Julieanna mentioned, and all the studies show that they just gain the weight back because everybody's like, I'm starving myself, but that's changing their microbiome. But the interesting thing is some of the studies now, and with the patients that are having side effects, is that once they stop the drug, it's not just the side effects of like, oh, my gastroparesis, because people have died now from gastroparesis. You're stopping the gut from moving. When you stop the gut from moving, you actually get a decrease of serotonin. You actually get more depression symptoms. That leads to have these suicidal thoughts. But people have died from just the gut not moving. You can start looking at these cases where people actually end up just so blacked up. They die from the gut not moving at all. I mean, it's quite disgusting and painful. Okay, but we have to be careful because everybody, there's people, celebrities that are pushing it. Everybody's buying stock in these things, but we have to look at it as a society. Is it even sustainable, right? Because yeah, if you have insurance or you can pay $1,200 a month, that's one thing, but the average person can't, right? So there's like it's a disadvantage because a lot of people are now putting this on credit cards or they're going to clinics and they're paying for it, but that's not sustainable unless you're in Hollywood or you make a lot of money. Right. So there's a disconnect because then those people who have side effects, they may not have the healthcare to take care of those secondary problems. Right. And that's what we're starting to see. So I was, 2 years ago, I started saying like, this is not a good thing. I understand the reasoning why America has a weight problem. We do have an epidemic of obesity and blood sugar problems. And we do know that once we lower the weight, we do lower cardiac risk, blood sugar risk, blood pressure risk, inflammatory risk. That's a temporary fix because it's not solving the problems. These people are still eating a pro-inflammatory diet. They're still becoming deficient in nutrition. So when I see a patient now that comes in and they've lost weight, so physically they look good on Instagram, but when you test them nutritionally, you test their microbiome, it's completely dysfunctional. It's completely deficient. And they're actually in a more pro-inflammatory state. So we have to be careful of this outer appearance because that's just short-lived. And that's my warning to everybody. Now, again, For some people, it might be beneficial, but it's not a long-term solution. And I think it's going to be a bigger problem in the future.
Have you seen patients come in that have gone off of Ozempic or that are on Ozempic?
Most of the patients that I've seen that have been on Ozempic have had side effects that they had to stop the Ozempic, and most of them wanted to take it. So that I didn't prescribe it, but it's like and I'm like, hey, I'm all for it. People have to try because I'm not an anti-drug person, but believe it or not, I'm not anti-pharmaceutical. I'm anti-side effect, right? And so some drugs, we prescribe drugs every day that can help people manage disease. We like to reverse disease, more importantly, but it's like we don't throw it out; we use it. But the idea is that this is a too quick solution, right? Because nobody wants to address the bigger conversation that we're having in this conference, which is diet and the environment, the food, the psychological, sociological, economical stressors that people have. And so again, it's the Botox of the weight loss industry now, and it is what it is, but you'll start to see there's going to be problems. And now we're going to have to develop other drugs that are going to be for the side effects of these weight loss drugs. But yeah, I definitely people have lost weight when they've been on it if they can tolerate it. But most people have, the majority of the people who take it are not taking it correctly because they're taking it for weight loss indirectly, right? Through weight loss clinics or doctors who are just over going to prescribe because they're the doc that does the weight loss drugs, but they don't really fit the true criteria. And even of those people who fit the true criteria, they're still having that dysfunction. They just get a better gain overall quickly of losing the weight. So that immediate risk factors drop. So yes, it's a good thing. But again, the sustainability is not there. Economically, it's not there as well.
So Juliana, obviously one of the main reasons why people need this drug in the first place is because they are addicted to the pleasure of eating, right? They, for various reasons. In the Choose You Now diet, how do you address the balance between nutritional science and the pleasure of eating?
Well, I want everyone to love to eat. I think that's so important. If you don't love your food, it's not going to be sustainable. The whole idea is to find your new foods that are just as convenient, enjoyable, and reliable and familiar as the old foods that you used to love. And it's a matter of, gosh, there's amazing, amazing transformations that occur just by integrating healthy foods, like starting simple and starting different, eating these new wholesome foods, and all of a sudden your palate really shifts. I've seen thousands of people shift their palate to have new favorite foods. So I also really like to make the distinction to everyone that you are not broken. It's the food that makes you want the food. Those hyperpalatable foods that we are quote unquote addicted to, they make you want more. The more you have it, the more you want it. One dose I've seen countless times. One dose of one of those hyperpalatable foods will last a week. You'll get cravings and you'll have an increase in appetite from one serving. So the idea is to change your palate, to find the new foods you like, and to kind of like get your palate shifted down, like down regulated, so that you could taste the sugariness of a sweet potato and, the saltiness of celery. And like it's all done by changing your palate and changing the different foods. And to let go of the idea that there's anything wrong with you because you want those foods. Those foods make you want them. So the more you can stay away from them, the better you'll be. And the more you'll enjoy the healthy vegetables, fruits, whole grains, legumes, mushrooms, nuts, seeds, herbs, and spices that I want people to enjoy in infinite tasty combinations. But it's just a matter of like going through this threshold. But every time people are like, I will never eat that again. Well, you have one hit of it and you're like, oh yeah, I remember how good it is. And your brain lights up. It is a real biochemical cascade that takes place. You explode with dopamine when you eat something really hyperpalatable, and it changes your whole chemistry. It's that powerful. So it's not you that's something's wrong with you, or it has nothing to do with any of your like, any kind of anything. We're socialized to love those foods. They taste amazing. They light up your brain. Of course you want those foods. So the less you have them, the easier that transition is. So I work with people to make sure they know, like, first of all, find the foods you love. Have to love your foods, and then be very strategic about when you have those hyperpalatable foods. Because if I told someone, or someone told me, you can never have another chocolate chip cookie, I can't live with that. Forget that. I'd rather just have all the chocolate chip cookies, or I would never want to change anything. So I tell people, just not right now. We kind of make it very strategic. And you're finding new foods you love. And then I call something called the days of deliciousness. So I don't like to call it a cheat day, because who are you cheating on? It's your own self, and you want to like love yourself, right? Choose yourself, choose you now. And so a day of deliciousness means let's say Thanksgiving, I love to have my Aunt Mary's pumpkin pie. We do it all together. It's very special to me. So you plan on Thanksgiving, you're going to have that pumpkin pie, whatever else you have at that meal. It's your day of deliciousness. And you go in it with intention. And if you go there with intention to enjoy every bite, savor every single morsel of it, knowing that for a week after, you're going to be craving pumpkin pie and you're going to have a bigger appetite per se, but it was worth it because you are not feeling guilt or shame or regret or anything because you're enjoying it, and knowing you're going to get right back on plan at the next meal, no harm, no foul. And it's nice to know you could build these days in and still have a overall healthy 99% of your diet, 90% of your diet. If 90% of your diet is wholesome and healthy and not stimulating the dopamine releases like that, you could absolutely get away with having it. The other thing I make people notice or recognize is when you have a day of deliciousness like that, you will not feel the same afterwards. It's just like if you've been used to eating super healthy all the time, you feel so good. And I make people really like sit there and feel it. And how good does your GI tract feel? How's your energy? How's your sleep? How's your everything? And we really kind of marinate because that which you focus on expands. So I have them really focus on how great it feels when they've got some momentum going, really eating super healthy and having this wonderful plan in action. And then, okay, here's your day of deliciousness. Now really sit and note how you feel. And everyone's like, I didn't sleep well. My stomach was killing me, blah, 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 blah. But they enjoyed it at the time, and then they remember why they like to stay on a plan. So it's positive reinforcement, and it's just practicing. So the goal is find your new favorite foods that are health promoting and wholesome, and leave these hyperpalatable foods for a day of deliciousness, being cognizant of what it's going to do to your brain and body so that you can be prepared for it. Because, knowledge is power. Once you know how your body responds to things and know how to recover from it, that's everything you need to know. And then you get to choose from there.
Great. Thank you.
Yeah.
And
So
go ahead.
yeah. So like what we do is we like we have cooking classes here at our clinic, and then we go shopping with our patients. But it's transitioning them to, because I think the misperception that Juliana and I will get from our clients is that because they're like, oh, hey, you got to talk about plant-based diets, is that they think that we're just eating kale and quinoa or three-bean salad every day or whatever. And one of my big pushes, which I've been saying for the last couple of years, is as you can see behind me, is like we're missing the spices, we're missing the flavors, we're missing in plant-based cooking. Because the general person does not know how to cook. So when they kind of went plant-based, they took out the meat that was the main, and there was sides that was plant, vegetables, and grains and legumes, and they just didn't know how to take the rest of that plate and fill it up, right? And so most people are not eating enough plant-based foods, and so they don't feel full, and then they feel like, oh, I felt better when I was eating the meat, or etc. So it is something that we want to start incorporating the spices, because when you start including spices, then you get into the healing medicinal powers of foods. And also the flavors. So like, people ask me like, what did you having tonight? I'm having vegan tacos. That's what I'm having. What I had yesterday, I had pad thai yesterday. I'm having spaghetti and meatballs. It's all plant-based, right? But it's not just a salad. And I think that's the biggest misperception, that most people come in and say, hey, and so meeting those people where they're at and finding. So if I have someone from Louisiana, or someone from Chicago, or someone from New York, or LA, or someone from France, I have to find like, what are they eating, and then just make it healthier. And that's the easiest transition. I think a lot of people feel like they have to change their whole diet, change their whole taste. And they'll actually appreciate those foods even better. Like Juliana said, like you can actually taste the real richness of the foods. And so that's one thing that's really important, is to bring back spices, and also have the patients learn how to eat and incorporate foods that are familiar to them, rather than something that seems to be completely foreign.
Great. Thank you. And so on a plant-based diet, what supplements are essential, and where do supplements fit in? And I'll ask that to you, Dr. Pai.
So what we like to look at is supplements are supplementing the diet, not replacing the diet. That's a key thing that I've always been saying to everybody. So we actually tested, like put it to the test. Where everybody says, well, eat healthy. Well, even if they weren't eating healthy, they think they're eating healthy still, right? So what I like to do is I like to check everything. Like just like, here's the baseline of what they think is the best diet for, because even if they're not ready to transition, they'll say, well, how are you feeling? Well, they're coming to me for a reason. Like otherwise they won't be coming to me, right? so it's like, and here's their medical list, and here's how many codes and diagnoses. I got arthritis, I got colitis, I got headaches, I got back pain, I've got blood pressure, I got blood sugar problems, I got thyroid problems, I got so I got cancer. So there are all these problems, and it's like, well, how's that working for you, really? Right? So we have to look at like but But just saying eating plant-based is although it's the foundation, we have to look at like, well, then what are those food triggers? What are the ones even of the plant kingdom that's causing inflammation in them? What is their deficiencies? How is their microbiome functioning and all? Because that's how you individualize. Otherwise, what happens is 80% of people will have improvement of almost all their symptoms, and you'll see parameters get better: blood sugar, blood pressure, weight, etc. Even the cancer, everything gets better 80%, but 20% won't get better. Why? Because that's the individualizing of the diet, of the nutrition of that. So when we look at supplements, then we have to look at like not to say, oh, this is good for everybody. Now, certain things are good for everybody, like vitamin D, right? Now, if they have it natural levels from the sun, all power to them. But we like to get them into a targeted goal. Our goals like to be around between 60 and 100. That's what the data says. Some people a little bit higher. If they have chronic diseases, cancer, or autoimmune, maybe around 70 or so. But this is what, because that's the data shows it's more for immune system beneficial, like a biomarker that we can follow, and it's really inexpensive and easy to take. But then we give like natural anti-inflammatories like the bosmeric as a daily for inflammation, because we want to, even if someone's eating an anti-inflammatory diet, they still usually have a pro-inflammatory lifestyle. Right? Most of us are on their legs or on their feet. They're having hardworking jobs, and so instead of taking a non-steroidal anti-inflammatory, we want to give something that's safe, clinically effective, that's potency and pure, and delivers also a variety of other benefits. So, I don't look at like, oh, you need to have this whole list of things. What we like to look at is like, what can we do to help your inflammation? What can we do to help your immune system? And then anything else that's deficient, then we will tell you what foods, because that's what all the testing and everything will tell us to do. We teach them the skills of how to eat that way. And then like what Julieanna's talking about, it's like, how do you deal with really the biggest challenges like cooking, access, and the sociology and psychology of all this, because the stressors of foods, and even telling people that they need to eat healthier is a stress to them, right? And we were just having a little discussion before we came on, and she lives in LA, which is fantastic for a lot of options to go out to eat. I live in Albuquerque, which is almost a nightmare to have plant-based options. So it's a challenge where that person's at, because sometimes they can say, hey, why don't you go here, try this, and they're gonna go, oh my god, I didn't know the food was so good, I can easily do this. And when you don't have that kind of experience, then sometimes it's harder to convince them, right? So that's why we have to then provide as many tools as possible. But I don't look at like, you need to take this. We like to individualize that, because then it's like, that's what they really need to take. Otherwise, it's just the sell again.
Thank you. And Julieanna, what are your thoughts on supplements? Which do you think people on a plant-based diet need to take, and supplements in general?
Yeah, very similar views. And so I prioritize certain nutrients that we need to think about, like B12, vitamin B12. Sure. Anyone on a plant-based diet, or anyone, no matter what you're eating over the age of 50, has to supplement with vitamin B12. I don't recommend using fortified foods because it's unreliable, and the consequences of not supplementing with B12 are so potentially risky, like the potential for irreversible neurological damage that you don't find out until it's too late. It's not worth it. So the cheapest, most effective, safest way to avoid vitamin B12 deficiency is to supplement. And that's really important. So B12. Vitamin D, because vitamin D is a fat-soluble nutrient, I do have my clients test to know the dosing if necessary, because it's not like vitamin B12 where it's water-soluble, and if you have too much, you'll just excrete the excess. Vitamin D is definitely important, but I want to make sure we look at blood work for that one. I make sure everyone's getting their iodine. That's become interesting of late because of all the fancy salts that are not iodized, and we're seeing goiters come back, which I never thought was imaginable since I was in grad school, but I'm seeing those a lot with thyroid issues. So iodine is something we need to be aware of, and zinc is something we need to be aware of, especially it's even come into light since the COVID and everything happened. So more people I'm kind of having a lot of people supplement with zinc as well. I am still recommending the long chain omega-3 fatty acid, the microalgae, docosahexaenoic acid, the EPA and DHA, both, because we don't know still if there's any repercussions of having lower levels of EPA and DHA in the bloodstream. And no matter how much, I do recommend the ALA, the plant forms, flaxseed, chia seed, hemp seed, tofu, walnuts to get the ALA, but we're not converting as much on a plant-based diet. So I am still recommending the long chain EPA, DHA, microalgae supplements to most of my clients. So I mostly have most of my clients, generally speaking, take a multi, and then we kind of look at the details in lab work and make other adjustments as needed.
So if I can further answer on that, to carry that further, because I want to make sure I don't forget about the B12 as well. Yes, anybody on a plant-based diet. But here's the interesting thing is, because since we've been testing nutrition now for like 25 years, and especially in the last 15 years looking at it, most people coming into my practice are not plant-based, and they still have deficiency, right? So it's kind of a misunderstanding or misnomer. Like, yes, plant-based people should be taking B12, if not even a lot of the Bs itself, because they're just kind of depending on the foods quality that we're getting. However, people on a standard American diet are just as low. And the reason being is because their animals that they're eating is also deficient, right? Because 99% of animal protein is factory farmed. So they're not eating their microorganisms that create the B12 because they're all factory farmed. Right now, if we actually eat farm to table, like traditionally, like way back when, there was a little bit of these microbes that would actually give us B12 because the carrots weren't washed correctly, for example, and there's a little bit of dirt in the food kind of thing. Now everything has to be sterilized because of animal protein contamination from factory farming into regular farming to our lettuce and tomatoes, etc. But we have to look at is that when we look at the nutrition, is like, yes, zinc is good. Let's test it. When we look at like vitamin A, C, E, CoQ10, glutathione, how are you detoxifying? All your B vitamins, not just B12 and folic acid, which most primary care doctors do. We want to look at all of them because if someone has neuropathy, what about your vitamin B1? And then what form of vitamin B1 should we give them? For example, magnesium, zinc, molybdenum, now omega-3s, 6, 7s, and 9s, right? So the interesting thing, there is this misunderstanding that was perpetuated in the industry about people not converting, or people, you can't get enough, especially plant-based, you can't get enough omega-3s in your diet. But when we test it, we actually test the ALA, the EPA, and DHA, but we also have the ability to test the conversion enzyme. So there is a certain percentage of people that will have an impaired delta-6 desaturase enzyme. And in those patients, definitely we have to provide them with a plant-based omega-3. In fact, I was the first person to actually consult and create, was it 2012? Plant-based omega-3, right? Now it's like a big thing, but anyways, that's how old it was going back then. But the idea is that we used to think, and even myself, like, that's why I was consulted to create the products, is everybody needed it because we were sold that. But what we were sold is because the industry that was actually fish oil companies, and that's what they were pushing fish oil, is because people eat a high omega-6 diet, which is pro-inflammatory if it's too high. We have some, but we don't want too much. And we're not eating enough omega-3. So the idea is like just to flip that ratio was just to sell a product that would be more anti-inflammatory. And now we understand that we want to go plant-based because of the sustainability issues and the other issues with fish. That's the whole section in my book talking about that. But what we didn't know is that there was a subsection that they took and they said nobody's converting. That's why you need it. But that's not true. So when we test our patients, if they come back and they have the enzyme, and I can measure and their EPA and DHA is great, then I'm like, yeah, flax, chia, hemp, walnuts, great. You can have that all you want. It has protein, has fiber. You're going to get the omega-3s. You're going to get all the brain health, heart health, inflammation lowering, and reduction benefits, but you don't need an omega-3. But if those people are impaired, you better be taking it because you can eat all those things you're not converting. So we like to really now, 10 years ago, we didn't have the ability to do this. So the recommendation is not bad. More omega-3 is helpful, but the idea is that when we're trying to looking at getting targeted responses, then we want to know, because a lot of people are like, I'm already taking 8 to 10 pharmaceutical medications. I'm already taking, 10 to 12 or 15 supplements from my other healthcare providers. We like to look at what do you really need and then target those and then really surround everything from the diet and then build on targeted things that your diet is either not able to get or you have a specific health condition that we need a little bit higher doses or something more specific.
And how would someone go about testing for the enzyme for conversion?
So that's actually part of the nutrition test that we do. It's part of a pathway. And so, for example, here's another thing. A lot of people, and Julieanna, this would probably be very specific for her clients since she's dealing with a lot with weight loss. Because, here's a challenge with even the plant-based diet patients who are also trying to lose weight is that we were sold, oils being like super healthy, right? Now, they're not super bad, but they're heavy, dense caloric foods. And so a lot of people are pouring olive oil on everything and not understanding that's just liquid calories. And so when we're measuring then their omega-9s, we see almost every patient now coming in and they're super high. This is like olive oil, avocado oil. And it's like they're just using too much. Now, it's not going to affect their lipids. It's not going to be dangerous. But when they're looking at a weight issue, it's like they're just consuming this, hundreds and hundreds of calories a day, not knowing, because they're like, hey, I'm only eating this, I'm only eating that, but they're putting in the pan, they're putting in the salad, they're putting in, mixing in all these other things. Now understand that's calories, and they're having 1,000 calories of oil in a day on top of the food, right? So we like to look at, some of that is a guidance because some people say, oh, I don't use much. And I'm like, yeah, you're way off than what you need. You can cut down. Now, some people are on the other side. They're on the extreme of this, no oil, the other extreme of the plant-based world, right? And it's like, you need some, right? Because again, the people in the blue zones, they're not zero either. There's no salt, no sugar, no oil. But again, that's these extremes because American lifestyle and restaurant industry and fast foods and all is heavy over here, and then there's also an extreme side over here being restrictive. We want to find like what is the physiological parameters that the patient needs, and then are they converting? Are they having too much omega-6s? So if someone's animal protein based, then they're gonna have a lot of dairy, they're gonna have a lot of meats, they're gonna have a lot of omega-6s. But also if they're plant-based and they're eating French fries all the time as well, they're getting all these vegetable oils, we can also see a lot of inflammation from there. So it's a really nice thing to look at so that we can actually guide the patient, because a lot of people, that as Julieanna will know for sure, and like me or anybody who's working in these panels, is that what a patient reports can be completely different than what the reality is happening, right? Because everybody's perception is like, I'm eating healthier than I proclaim, right? And that's just with all dietary studies is the hard fact of the truth in reporting, right? Because nobody wants to say I had more chocolate chip cookies or a donut, whatever, right? Like, so there's a little bit of that issue. And, there's a guilt issue, like, well, maybe I only had this many nuggets at the store, or only this many pieces of chicken from the bucket or whatever. So there's a little bit of the diet histories is kind of, but when you actually test that person, then you can let them know, because sometimes it takes a big burden off of them. Like sometimes they're thinking like, oh, I'm doing too much. I'm like, you know what? It's fantastic. You don't have to worry about that. Then it takes a huge stress off their life. But I'm like, you need to eat more of this. Oh yeah. And then these are the foods that have that nutrients that are highest in there. So you're getting your phytonutrients, you're getting your antioxidants, you're getting your fiber, you're getting your protein, you're getting your, all these other benefits rather than even just taking a supplement. So that's kind of how we approach that.
Great. Thank you. So Julieanna, how do you reconcile the differences between nutritional advice given by various health experts and dietitians? Right. It's all over the place.
Well, that's a huge question.
It is. And by the way,
that was kind of loaded, by the way.
Before I just throw it out there, because I know
I'm the only one you should listen to.
Both you guys have a lot to say. So we have about 10 more minutes before we need to wrap it up. So just keep that in mind when you answer.
In a nutshell, the hardest question you just asked me is that there are so many approaches. And there's so many approaches to eating healthy. What is healthy? And compare, we all have biases. We all have inherent biases that there's no way around. Even a scientific method can't get us to interpret a study differently without some bias underneath. No matter what we want to think about ourselves, we are human. Everyone here, we're all human. And so I don't know. I look at the literature. My clients have predictably lost 0.4 to 0.8 pounds a day of body fat with my program. I've been doing it so generalizably and so predictably for almost 20 years now that no one can unseat what I've learned. And I am so open-minded and curious to learn. Even these new weight loss meds, I'm so open to seeing how this is unfolding and like understanding where things fit in for different people, and knowing that there's a lot of information, there's a lot of messaging, but there's so much mixed messaging and there's so much mismessaging, which I think is really harmful. And I find myself, I always call myself a nutrition myth debunker, because all day long I'm debunking myths that people are being bombarded with, on social media and from their friends and family. And so I guess the answer is you could do your best. You learn, you read the literature, you have to be as analytical as you can. I don't like the idea of finding a guru and following anything they say, because that could be harmful too. So my role as a healthcare provider is to stay open to the new science and everything that comes out, the new ideas, the new trends, my clients' concerns, and most importantly, the humanity, and knowing that there should be no guilt or shame or anything in this industry of trying to eat healthier and do best for yourself, but you just want to be there to guide people in the best way that you possibly can. And based on, as obviously you want to keep it as close to evidence-based or all evidence-based as you can, but science changes too. Nothing is forever. Nothing is official, except for, I was just saying at dinner that there's absolutely no such thing as absolutes, including in health.
Okay, thank you for that. And Dr. Pai, your thoughts on the subject?
So again, it's a headache, right? Because every day there's just misinformation. But remember, the industry, which is all industries, right? From the supplement industry to the drug industry to the weight loss industry to hospital systems to insurance companies to fast food industries. Like in my book, I even have a section going into this in detail where the top 5 insurance companies own 100 million. This is like in 2016, so it's even more now. They had $100 million in stock in each fast food restaurant. So each of the top 5 companies have 100 million of McDonald's, Burger King, this, that, because they're getting you this way, they're getting you that way. So like the system is kind of rigged. And I always tell people, you're not here by default, you're here by design. right? This has all been marketed. I mean, we're all guilty of being marketed to, and we cannot not be marketed to, right? So we all grow up. We had a food pyramid, we had the songs. Everybody like so we all know what I can say a phrase that's been marketed from the food industries, and we all can answer the rest of the phrase, right? That's how powerful it has been, and that becomes a cultural norm, becomes a psyche norm, and it becomes a worldwide phenomenon of the standard American lifestyle and diet. So it is hard to dispel that. But at the end of the day, you have to look at the science and the true evidence. Not everybody is evidence based. Although I know there's a lot of people who write books, and then a lot of people, who are not on this program, thankfully, but who are popular. But again, followers and the amount of likes doesn't mean anything. At the end of the day, is like, are these people seeing patients, and can they show the benefits, or do they have people? Everybody can have this quick fix, but I'm a science guy at the end of the day, so it's like you can't. I follow the laws of nature, right? That if you look at any kind of traditional medicine, which I've been trained in and looking at, like Ayurvedic medicine, Chinese medicine, these things are thousands of years. Western medicine is really new. And even from my residency 30 years ago, more than half the drugs that I came out when I was a resident are no longer in the market. They've been pulled off, right? So we all think like these are like, oh, we're great. But they don't even know how these drugs work yet. They don't even know the side effects, right? But that's just how it is. It's the latest and greatest. And so like you can't biohack the body. Although there's even conferences now on biohacking the body. You have to follow the laws of nature, follow the laws of science. And it does take some time. These are lifestyle changes. Everybody wants an overnight fix, right? It's a lifestyle practice. Even for myself, even for Juliana, it's a lifestyle practice. Every day we're still making better decisions and try not to make a worse decision, right? It's not like, oh, we get it and we're so great, and it's not like that. It's like anybody else who's a professional. If you see a professional athlete, we see them on the court or in the game for 15 minutes or 20. Wow, they're spectacular. But they're practicing every single day when you don't see them for a year or years and years and years. So it's a lifestyle practice. So a lot of people have this pressure, I think, now with social media, that it has to be instant. And that's why when they do these drugs of any kind right now, it's like to get them over the fix, get them over the hump, and then quickly before the Academy Awards, I can lose weight. But what we want to look at is, what is the long-term benefits? Like, how are you going to have this investment? It's like putting money into a good mutual fund or a stock fund and seeing it grow over time, not this wild stock trading where it's going to go up and it's going to crash tomorrow. And that's kind of what social media is doing right now. It's kind of playing with these people's fears, is playing with something that's controversial. And that's why I want to just always be focusing now on let's just focus on what are the positive things that people can do. Julianna's talking about same thing about behavioral changes and those kind of things. And then let's start with that rather than trying to debunk something else. I mean, we have to do it every day in our practices because people are coming in and say, oh, I saw this, I saw that. But then at the end of the day, once you understand how the body works, once you understand nutrition, once you understand, what's an inflammatory food and not inflammatory food, what affects the microbiome positively or negatively, then the answer just lies in itself. Like, you don't have to be convinced. That's just what it is. But the idea is that getting people to get there will take some time.
All right, great. Thank you. So we have a question from one of our audience members. So Ali D, please state where you're from and ask your question.
Yeah, I'm from Southern California, and I'd like to have your opinion, doctor, on a critical vitamin D level of between 7 and 16. I'm out in the sun in the garden daily. I don't use sunscreen. And I'm on 2 prescriptions of 50,000 units each. So that's 100,000. And I take 5,000 daily. So it's 135,000 I take every week. And this has been going on for years. And I can't get the doctor to do anything else but just keep giving me these prescriptions. And I'm worried about my health.
Okay, so a couple aspects of that. Number one is that a lot of times when they write a prescription for vitamin D, you have to make sure it's vitamin D3, not vitamin D2. Even though they write vitamin D3, the pharmacy has the ability to change it to D2 because it's cheaper, and they can do that without telling the doctor. So that's one issue. There's a little bit of an absorption issue with D2 and D3. Number two, what Juliana said before is that vitamin D, A, D, E, and K are fat-soluble vitamins. It absorbs 60% better with fat. So like a little bit of avocado, a little bit of nut butter, a little bit of anything like that that's a little healthier fat. You want to have it with that meal that will help uptake the absorption. Now, when you're taking that many doses, and that was originally Dr. Holland Sunil, like who's the father of vitamin D, you know, when he wrote the article coming out, it was just a suggestion, 50,000 once a week for 8 weeks, right? What we didn't know is that usually it went up and then people stopped taking it because that's all he said, and then it went back down, right? So that's why you're 5,000 daily. But if you're taking it, even you're taking with fat, even if you're taking a D3 and it's still that critically low, which it is very low, then what we would have to look at is there's something wrong with the microbiome. There's going to be some kind of increased intestinal permeability problem, which is a malabsorption, kind of a leaky gut kind of thing. And something is causing that dysfunction because you are taking, you know, if you're taking that, it should be higher than that, even with the 5,000 I use. Even getting the sun. Now, some people just don't absorb it as well in the sun. Some people in my patients, they can have fantastic, their vitamin D is 90 and they're just, you know, they just get sunshine doing gardening. And I'm like, you don't need supplementation. But what I would do is if I were to see you, if you were to, you know, do a consultation, then we would look at like exploring like why is your body not able to raise those levels, even though you're on doses that should be at least right now 40 or 50 minimally with that much taking it for that period of time, taking both. But there's definitely something wrong with the body's absorption of it rather than you're taking something wrong or the dose is wrong.
All right. And Julieanna, in 1 minute or less, any thoughts on vitamin D and what maybe Ali D's issue?
Oh no, that was perfect answer. I support that answer completely. That is a really, I have not heard those situations. I mean, there's a lot of things that can get in the way of sun absorption, like excess body fat, you know, darker skin requires more time in the sun, but it sounds like you're doing everything right. So I think looking at the microbiome is a really brilliant suggestion.
All right, great. Thank you so much. Well, that wraps up our time together. So thank you so much for all the wonderful information that you shared. And I look forward to your presentations later in the week. So if we could unmute the audience so they can say thanks.
Thank you so much.
Blessings.
Thank you. It was wonderful. I learned so much.